I'm David Sides from Lynch's River Electric Cooperative in Pageland, South Carolina. Welcome to Along Those Lines.
Hi, everyone. This is a podcast about electric cooperatives, the work they do, and the challenges they face. I'm your host, Scott Hoffman. Rural Americans face the same health challenges as the rest of the country, but often without access to the essential medical and health resources that they need. We'll talk to 3 co-op leaders involved with programs to get basic care to members of their communities. First off, David Lambert of Withlacoochee River Electric Cooperative in Dade City, Florida. His co-op has long been involved in developing services for the community, and just a few years ago, they heard a call from members to address mental health needs, so they took measures to open a much-needed mental health facility. David, welcome to the podcast. Thanks so much for being here.
Thank you for having me.
So you have this new project called Vincent House. Tell us about how that project came about and some of the history behind how you guys got involved.
So, Scott, about 5 years ago, we were asked to get involved to increase mental health capacity in our service territory. It was after a United Way community survey that found that mental health was the number one issue that the community was concerned about. So our CEO, Billy Brown, asked me to get involved and see what we could do to increase mental health capacity. So, as you know, mental illness is the number one cause of disability worldwide. It's more than cancer, diabetes, or heart disease. 90% of all suicides are mental health related, and we've seen a significant increase in suicides. Just in one of our counties, we had 5 suicides in 1 week in a small county. So we knew that something had to be done, and we found Clubhouse International, and we found that there was a clubhouse right in our own backyard in Pinellas County called Vincent House. So Vincent House started after parents, Diane and Elliot Steele's daughter was diagnosed with a mental illness, and they could not find quality mental health services and a path for their daughter to recover.
And that was a local family near where you are, in Central Florida?
Yes, it was in Pinellas County, and in 2003, they started Vincent House along with one of our members, Bob Dillinger, who's the Pinellas Pasco public defender. And Vincent House opened in a strip mall, and they started doing work on mental health. And when we went and visited, we just seen a program that was like no other. It really focused on people and getting them their life back and getting them reintegrated into society and employed in the community. And that's what the mission of Vincent House is. You know, it is to assist and promote and celebrate individuals recovering from mental illness.
And David, talk a little bit about some of the specific things that Vincent House does for their clients who they work with.
The model at Vincent House is based on the belief that all of its members, because people who attend Vincent House are members, just like co-op members are members. And it's under the belief that they can lead full and successful lives. As they go along, they start training people on how to get employed in the workforce. So they teach them Microsoft Office. They have a whole commercial kitchen that teaches them how to prep food. They help them get their Safe Serve certification. They also, if the person doesn't have a high school diploma, they work with them on getting their high school diploma or GED. And through that, we partner with local employers through transitional and supportive employment to get them reintegrated into the workforce. And the goal is for that transitional employment to lead to full-time employment. Transitional employment, so that might be at the public defender's office doing filing. We have transitional employment at the Pasco County Housing Authority. We have grounds maintenance, and they act in a customer service role by answering questions and doing switchboard operation. So just those tasks that could lead into a full-time job. So that's what Vincent House focuses on. It focuses on getting these folks employed and into recovery and back into the workforce.
Our multimedia producer, Denny Gaynor, actually visited Vincent House. He took a tour of the facility and got to meet some of the members who are benefiting from the services they offer.
This is part of the culinary unit. It's the cafe. Here we learn cash register skills, customer service skills, basic handling money skills, giving change, and coffee. I didn't know how to make coffee until I came here because I don't drink it. But now I can make coffee for other people. It's the little things that matter.
Once Vincent House opened up here in Hernando, it gave me a new purpose in life. It gave me a new sense of belonging, and it gave me a reason to get up as early in the morning as possible. I've had 2 transitional employment jobs, and I'm considering going back to school, and I hope to in the future get an office job like in bookkeeping or accounting or something along those lines. Also, thanks to Vincent House, I now live on my own. I used to live with my parents for almost 40 years, but I've since been able to move into my own place, and I enjoy living on my own, and I also thank Vincent House for helping me find residency. So it's definitely changed my life for the better.
David, is there an initiation fee, or is there a fee to be a member of a Vincent House? And if so, is there public support to help folks who ordinarily wouldn't be able to afford it?
So people who come to Vincent House, we never turn anyone away. So our funding works. We receive about 35% of the funding coming from the federal and state government. 65% of our funding is raised privately through donations and other grants. People do not have to pay if they do not have the ability to do so. However, if they do, we would not only like them to help, but we would like their family to be involved. And it aids in the recovery because people who have skin in the game, they're more focused, and it really makes them feel a part of something bigger than what they had.
What is it that makes you all so progressive on the community development issue?
Well, at WREC, we believe that we are here to meet the needs of our members, not just providing them affordable, reliable, safe power, but providing a voice for them for advocacy and filling a need in the community that has not been met. Wherever there's a need and it's lacking in services, we try to step in and bring light to that and fulfill that gap. And at WREC, we're no different than any other co-op out there. Co-ops can do what we're doing each and every day. We didn't pick mental health. Our membership picked it for us. It was something that they needed, and we were responding to that need.
And the idea is that co-ops, being by the very nature of what they do, they have connections within communities that they serve that other entities may not. And they also have a mission that is part of their founding charter that says that they will help these communities. So there really is a unique synergy there. There's a uniqueness to what co-ops do that makes them particularly well placed to do these things.
It's our last and 7th guiding principle, concern for the communities that we serve. But in today's modern co-op, it really is our first principle because we've built the power lines. We've got the poles, the wires. We've got all of that infrastructure in place. We brought electricity to everywhere pretty much throughout the country that didn't have it. But what is our next phase and what has been our next step? And that next phase and next step is for our communities to build them, to make them stronger, and to make them better. And that is just what we do with the 7th cooperative principle. It shows that you really care and that you are invested in them, the member. And I think that that's really is what is the game changer for us. That's what distinguishes us. And that, to me, is what will carry us 100 years into the future.
David, thanks so much for being on the podcast.
Scott, we appreciate it.
Next, we go across the country to Wyoming, where the statewide is helping its member co-ops literally bring healthcare to its front doors in the form of mobile medical scanners for members to use. Shawn Taylor is the executive director of the Wyoming Rural Electric Association. Shawn, thanks for being on the program.
That's my pleasure.
So tell us a little bit about some of the rural health challenges that you're facing in Wyoming.
Well, it should be kind of common sense, but really when you think about what we've been dealing with in Wyoming, loss of population, our economy very heavily reliant on minerals, and that hasn't been quite where it has been in the past year. So you lose population, you lose employees, you lose doctors, and we've kind of been seeing that over the past probably 5 to 8 years really come into play. And then you lose the doctors, and then you have long distances, which costs money for people to go and see another doctor. So it's kind of economy, population, loss of healthcare.
Yeah, and the statewide recently began or is working on a program to provide health scanners to some of your member co-ops. Talk a little bit about the equipment first. How does it work? What does it look like? And then we'll get into how you're expanding this program.
So it's pretty exciting. It looks kind of like an oversized phone booth. You go in and close the curtain, and you get down into your skivvies, and there's a touch screen with an avatar that talks to you and put in your height, weight, and email address, and then you just hold on to a handle and it scans you in a matter of 5 seconds, maybe a little longer, maybe 10 seconds. And then after you're done with the scan, you'll get an email with all the things that it measures. Right. I guess that's the best way to put it.
So when you finish the scan, within a few minutes, right, you get an email with all the details and the parameters that it measured.
I think after I did mine, within about 5 to 10 minutes, got an email with kind of a summary of the scan, and then it also sends you an action plan to address some of the potential problems that the scan picks up.
So what are some of the data points that it gives you, like blood pressure, body mass index, things like that?
So it does do body mass index, which is basically based on your height and weight and information that you input. It doesn't do blood pressure yet, but that is addition to the scan that we're already talking about. Mainly does a lot of posture, how you stand, how you hold your neck and how you hold your head. It can pick up on a potential bad hip or problems that you could have with knees. Unfortunately, I can't explain the technology behind it, but that's what it picks up on.
Yeah, that's amazing. And the fact that if you have an undiagnosed, you have a back problem or something, and it can tell you, oh yeah, here's a point that it picked up and we think you ought to get this checked out.
Yeah, exactly. In fact, I just found my wellness report from the last time I did it, and it gives you 4 health scores, 4 wellness findings, 79 measurements. Again, body type, lean body mass, neck circumference, chest circumference. I could go on and on. One
of your members does the scan. They get their data. What if they don't have a primary care physician to send it to? Is there any kind of solution for getting it into the hands of a professional for analysis?
Yeah, so part of the working group in this whole project, they're called the MAVEN Project, and they're headquartered both on the East Coast and the West Coast, so it's kind of neat that they're going to be involved in the rural healthcare here. But what they do is they have kind of a whole host of volunteer physicians that cover the gamut of practices. And so say a member goes in, gets a scan, doesn't have a primary care physician, or does, but that primary care physician doesn't have a specialize in any particular field, they can contact the MAVEN Project, and the MAVEN Project will find one of the volunteer specialized physicians that the co-op member, their doctor, or if they don't have a doctor, will work with one of these volunteer physicians to address whatever the results of the scanners show.
I know you're working with a group called Spiral Health who manufactures these scanners. Tell me a little bit about how this whole partnership got started and got off the ground.
Well, I'll tell you briefly how we kind of got hooked up with Spiral Health to begin with was through the Integrated Test Center, which NRECA is involved with, Tri-State G&T is involved with, Basin Electric is involved with, and the gentleman from Spiral Health, Lee Stein, is also on the X Prize board. So he's been involved with the Carbon X Prize at the Integrated Test Center and saw that the co-ops were willing to step up and try and address, the carbon issue. And he thought, what about addressing the rural healthcare issue? We have, access to our membership. Our members trust us. And you said this is addresses one of our co-op principles, concern for community. And we're the least populous state in the country, so why not start working on rural healthcare here?
And you're working with a couple of your member co-ops to get these out into a wider audience. Talk a little bit about what the process has been there, which co-ops you're working with, and what are they doing?
Sure. So a couple years ago, one of our systems, Powder River Energy, had a mobile scanner at their annual meeting as part of their health fairs, and it was widely popular. They had to keep the scanner open, I think they said, for 2 hours longer than they had planned. They had folks waiting to do it. They go and get their blood draw through Wyoming Health Fairs, which is another partner in this whole project. And then when they do that, they also get the body scan. And so you get a whole kind of one-stop shop there with the scan and the blood draw. And so Powder River came to the statewide and told everybody about what they did with the scanner. We got in touch with the folks from Spiral Health that do the scans, and that was kind of where the relationship was born. And so fast forward to today, and we're going to have one of our other systems, High West Energy. They've already had some employee training on the scanners, and I believe they'll have a scanner in their headquarters probably within the next 2 to 3 weeks. Powder River is going to bring another mobile scanner back to their annual meeting this year, next month, and then that scanner will go to their headquarters as well.
And then the ultimate plan, I believe, is to see if the rest of you have 11 member co-ops, right?
Yeah, that's correct. We're going to kind of let these first two systems, co-ops, have the scanners and then come back in maybe 6 months and talk about how it worked, if they were widely used, what all it entailed from the co-op's perspective. And then the other systems can decide, hopefully, that they'll get a scanner at their place as well.
So I know you're kind of being a facilitator for the two initial co-ops and then hopefully for the rest of them. What's the ultimate goal? I mean, it sounds like this particular device is a good way for people who wouldn't ordinarily see a doctor to just kind of get in and set a baseline.
Yeah, with doctors leaving the state, if a co-op member can go to their co-op headquarters, get this scan, send it to a doctor, and then not have to drive 2 or 3 hours, and then they can basically do all of this over telehealth. That's kind of the first goal, is to just address the access. And the scanners are really meant for predetermination, if you will, kind of find a problem before it gets to be too big of a problem. Then that helps on healthcare costs if you can address something before it gets to be a big problem. So that's access and costs are two kind of initial goals we hope to address with these scanners out in the co-ops. And then beyond that, it kind of gets to, and it's not just the co-ops, it's everybody that's involved in this initiative, to address the problems of Wyoming's rural healthcare and loss of population, keeping the young folks in the state. We've kind of phrased the coin, get Wyoming into the knowledge economy. And we've talked about this happens by having quality healthcare, quality education, and connectivity. And with these scanners, we hope to address the quality healthcare. We have quality education, we just don't have the population, and then the connectivity will hopefully come with these scanners. If we have to upgrade, the broadband that a co-op headquarters has in order for these scanners to work properly, then if we get that to the headquarters, then maybe that connectivity can just, reach out into the rural corners of Wyoming. So it's kind of a three-pronged approach.
Do you see any other involvement of the co-ops and the statewides in helping solve this healthcare problem?
It's kind of baby steps. We'd like to see the scanners all across the state in the co-op headquarters. And if it proves out the way we hope it will, we actually hope to work with co-ops in other states to maybe duplicate the model and help addressing the rural health issue across the country. I'd say that's what we hope to accomplish, in the next couple of years, is prove out the technology, have the empirical evidence that our members are using them, and not only just using the scanners, but using the information that they get to address kind of the preemptive health issues, and show that to the rest of the co-ops and go from there.
Well, you guys are doing great work, Shawn. I appreciate taking the time for being on the podcast.
You bet. My pleasure, guys. Thank you.
Last, we'll check in with a generation and transmission co-op in Arizona that's using USDA Rural Economic Development Loan and Grant, or REDLEG, financing to bring a range of healthcare resources to its member co-op territories. Geoff Oldfather is the Communications and Public Relations Manager at Arizona G&T Cooperatives. Geoff, thanks so much for coming on the podcast.
You bet. Glad to be here. It's exciting.
Describe some of the communities that your co-ops in Arizona serve. What are some of the difficulties that your member co-ops and their territories are seeing in terms of getting access to health care?
We like to say, I think we say the average for co-ops across the country is one member per 7 miles of line. And I know there are areas where our co-ops reach out to where it might be one member for 30 miles of line. That's not the norm, but that certainly speaks to how widespread some of our co-op service territories are. And because of that, you can imagine that the availability and the ease, if you will, of getting to healthcare services that most of us take for granted can become quite a challenge. All of our member co-op service territories do have population centers where there's healthcare, and often a very good level of healthcare. But those hospitals, those clinics, they're located in areas that are near the metro centers approaching Tucson and Phoenix, for example. Our northwest border of SSVEC service territory comes up against the outskirts of Tucson, but it's in the other direction. And this is true of all of our member co-op service territories. It's in the other direction where you have the challenges. And in my mind and in my experience from what we've done by supporting rural health care with this REDLEG program, the challenges are twofold. First of all, the rural clinics and the rural hospitals and the rural health centers, such as they are, and they're few and far between, are doubly challenged, not just by the distance, but by the funding that, the funding challenges that they face. Often they serve a population that is uninsured or underinsured, and so, they operate on very tight budgets. They operate on small staffs, and then they're also serving a population that finds it hard to get to them. Now, that's obviously not always the case, but that is, in a broad sense, the two major challenges that we face when it comes to rural healthcare. And think about this. You may have a clinic, a family healthcare clinic that serves a broad rural area that, is really spread out. But think about the specialty services, the cardiologist, the MRI machine that is needed to do a scan to find, more difficult to treat or more difficult to detect diseases. Those specialty services are especially scarce. And even now, with the improvements that are being made with some of the specific instances we're involved in, those are still challenges. You find patients that have to go beyond our service territories to get those services. So it really presents some challenges when you talk about rural health care. And the further out you go, the more those challenges expand.
Yeah, and you mentioned earlier the Red Leg program. Just for our listeners, Red Leg is a federal pass-through loan program that co-ops specifically have access to help do community improvement projects in their territories. Is that a fair summation?
Yes, the Rural Economic Development Loans and Grants Program, in our case, is a loan pass-through. We've been able to obtain grants, which we use to set up revolving loan funds, which we then use to make low-interest or zero-interest loans to entities in the rural service territories. And in our case, it has been the hospitals, the medical centers that have taken the most advantage of this, and I think with a great deal of success. The Red Leg program is a godsend for rural areas. It funds not just hospital and healthcare centers, but really any type of rural economic development project that improves the rural economy in three broad areas. It needs to create jobs, it needs to create a revenue stream, and it needs to, in general, improve the economy of the area where the loan is provided. And, you have to meet some financial requirements just like you would for a conventional loan, and we have a process that vets the applicants. But the real advantage here is that once they've gone through that loan application review process, the funds that are available to them, we've never charged more than 3% interest, and in some cases it's 0% interest over 10 years. And they also have options to extend the loans if they need to. And that's the flexibility that these rural entities, be they hospitals or anything else, don't have with conventional lenders. It really makes a difference. When we really started promoting the Red Leg program as we administer it about 10 years ago, the very first taker was Northern Cochise Community Hospital in Wilcox. It is a hospital that provides emergency department services and a level of critical care, but in most cases it's intended to stabilize a patient until they can move them to, one of the metro areas, Tucson or Phoenix. But in their case, they reached out immediately because they had been looking for a source of funding to move their emergency department from paper record keeping to digital record keeping. Now think about this. 10 years ago, at least in my world, probably in yours, everything was digital. I didn't work with paper records anymore. I can't think of anyone that did. But because of those financial challenges, this was something that had been put off for a long time. And when you think about it, it's hard to imagine any entity working with a system that in today's digital age that's as cumbersome as paper record keeping. And you would think, well, does it really make that much of a difference? It really did. It not only enabled them to speed up and add efficiency to the process of treating and administering to emergency room patients, it opened the door to other grants and financial opportunities that they could use in other areas of the hospital. So for them, it was a game changer. And it was the same. What happened in our case, I think, was once this occurred and the Benson Regional Hospital discovered that this source of funding was available, they took immediate advantage of it. And it was only a couple of years later that we were able to work with them to open an occupational speech and physical therapy clinic that was really badly needed here. Up until then, there was no one within probably 200 square miles that could get that kind of medical service without going to Tucson or Phoenix. And it's been extremely successful for the Benson Regional Hospital from the day they opened it. In fact, at one point, I think they were thinking of expanding. Now, they've added staff. They're able to meet the demand. But again, it was an area it was a type of medical service that was badly needed, and the Red Leg loan made it possible.
Is there a consequence for co-ops not getting involved? Since we're talking particularly about the healthcare crisis in rural America, are they uniquely positioned to help, and is there a consequence for not getting involved?
There's probably not a direct consequence if we just sit in the background and we don't take part. I don't think that it's necessarily going to hit our bottom line the next day, but there are indirect consequences over time. We're going to see people moving out of the rural areas. And we are. We have to have the services available where we live and work and where the co-ops live and work if we're going to have a healthy, thriving economy and healthy, thriving communities. And this is a critical way we can do it. And come on, if co-ops aren't going to do it, who is? We're just uniquely situated, and I think we have a unique responsibility to get involved that way.
Well, you guys are doing great work, Geoff. Thanks so much for being on the program.
You bet. I'm glad to talk about this. It's a great program, and the more we can do to get it up and running anywhere it's needed, the better. Thank you so much.
Thanks to all my guests and to you, our listeners. You can find out more about this and other podcasts on electric.coop. Until next time, I'm Scott Hoffman.
I'm Annie Hoyland from My Energy Cooperative in Rushford, Minnesota. Thanks for listening to Along Those Lines. Subscribe and rate us on your favorite podcast app.